Okay, so good evening. Okay, if you could find your seats. Okay, so good evening. My name is Dr. Jennifer Gardner. I welcome each of you this evening for a very special night to celebrate, ultimately, our 8 second-year doctoral students and your loved ones. Tonight's evening is going to be celebratory in nature, but then also with a focus on being able for the students to share the research study that they have worked on since last summer. So tonight is about being able to hear the results of the research studies that each of your loved ones completed in learning the process of how to engage in research. And then what we're going to do is each of them are going to be pinned by somebody very, very special. We ultimately will share with you what the symbolism of the pin is. It's also in your program. And then we'll also have an opportunity to hear our doctoral students be able to recite the departmental oath. I wanted to welcome everybody and share with you the overview, but for the rest of the night, I just want to invite Dr. Victor Michael Camacho to come up to the stage. So Dr. Camacho serves as the doctoral program coordinator. So he this evening is going to be able to welcome each of the students up and to call them up and to, in essence, I guess you could say MC the rest of the night. But before I turn this over to my colleague, I do want to recognize my other, all of our colleagues that are here this evening, both full-time faculty and staff, as well as adjuncts. It is a team effort in our Department of Occupational Therapy. I'm very proud of the team and the colleagues with which I work. So with no further ado, I turn this over to you, Dr. Camacho.
Thank you so much, Dr. Gardner. Okay, let the evening begin. Yeah. So I'm going to call up our first research group, the SALT. So we like to have students create their own identity. So we're going to welcome the SALT members Samantha, Anna, Lauren, Tanya, and their advisor, Dr. Jennifer Gardner.
Hi, good evening, everyone. So I just wanted to take some time to introduce my team and I. So I'm Samantha, and then to my right, I have Tanya, Lauren, and Anna. So our research is on grand round and the interprofessional preparedness, attitudes, beliefs, and self-efficacy among occupational therapists and speech therapy students. So just to begin our presentation, we wanted to go over some key terms that you'll be hearing throughout the presentation. So to begin, we have self-efficacy, which is a person's confidence in their ability to succeed in specific situations or accomplish a task. Then we have interprofessional collaboration, which is a big part of our study, and that's the partnership between healthcare professionals from different disciplines working with patients. Then we have the IPEC, which stands for Interprofessional Education Collaborative Scale, and it assesses competencies related to collaborative practice at the healthcare degree program. And then we have the IPAS, which is the Interprofessional Attitude Scale, designed to capture healthcare students' self-reported attitudes and beliefs about interprofessional education and interprofessional collaborative practice.
Okay, so why this matters. So healthcare today relies on team-based care. No single profession can meet all patients' needs. So strong teamwork leads to better patient outcomes, fewer medical errors, improved patient satisfaction. And students must be prepared when problems arise, so when roles are unclear and students lack confidence in explaining their role. IPE, interprofessional education, is when students from different professions learn together. It helps improve communication skills, teamwork abilities, and understanding of professional roles. It prepares students for real-world collaboration.
So then, okay, so then we have IPE teaching methods, which is students build self-efficacy through clinical fieldwork, real experience, simulation-based learning, and role-emerging placements. These experiences help students advocate for their role, develop professional identity, and improve teamwork skills. Grand Rounds. So Grand Rounds is an interprofessional learning experience hosted here at Kane. It's immersive case-based discussion with multiple health-related disciplines collaborating, and the students that participate are athletic training, audiology, counselor education, exercise science, genetic counseling, marriage and family therapy, nursing, occupational therapy, physical therapy, physician assistant, public health, rec therapy, school and clinical psychology, SLPs, and social work.
So Grand Rounds here at Keene University help support students develop essential skills such as communication, roles and responsibilities, and collaborative clinical decision-making skills. This is centered on teamwork and shared decision-making, where we work on a case together with other professions, and we really learn what each other's roles are. So this occurs once a semester for 3 hours, and our projects specifically focus on the last 4 sessions. So our research questions was, does Grand Rounds improve self-efficacy, teamwork skills, and real clinical performance?
So here's what the research already shows. So IPE improves communication, collaboration, role understanding, and students already do report that IPE has an impact on their increased confidence, better teamwork skills, but most studies focus on the short-term results. So when we began our research, we kind of had to look into what was the gap in the research currently. So research shows that IPE works right after the IPE experience, but the question is, do these skills last over time? And do students remain confident in clinical settings? With this study, we wanted to focus on the long-term impact.
So our study design was a mixed method study, quantitative where we had survey scores and qualitative where there were written responses. We examined short-term effects after Grand Rounds and long-term effects during clinical experiences. So in our inclusionary criteria, we had a recruitment email that was sent out by the OT departmental chair, Dr. Gardner, and SLP professor, Dr. Patton, to their respective programs after IRB approval. Approximately 157 OT and SLP students were invited to participate throughout 6 cohorts. Second-year MSOT and third-year OTD students completed all required didactic coursework and on Level 2 fieldwork. MS SLP students engaged in externships during the 2025 and 2026 academic year. 18 and over and currently enrolled in King University's OT or SLP program were the students included.
So as we mentioned, the participants were OT and SLP students. All participants were in clinical fieldwork or their externships, were 18 years and older, and originally our aim was to compare students who attended Grand Rounds versus students who did not. So the age range was about 4% were 35 to 44 years of age, 46% were 25 to 34, and 50% were 18 to 24. Our gender was 83% were female and 17% were male. And then it was split directly down the middle, so 50% OT and 50% SLP. And then for race, it was 50% white, 35% Latinx, and 15% Asian.
Okay, so what did we measure? We used two measurement scales, including the IPASS, which assessed interprofessional attitudes or their teamwork beliefs, and the IPEC, which evaluated their self-efficacy or confidence in teamwork. So we also assessed communication and collaboration skills, and the data was collected through a survey, and that also included open-ended responses. So for the participants, we had a total of 24 students who participated in the survey. As you guys already know, 12 were OT, 12 were SLP. The majority was female, and the age range was 18 to 38. Of these participants, we had 95% attend grand rounds.
So here we have the quantitative results, which will be kind of like our number results. So due to limited number of participants who did not attend grand rounds versus those who did, so we had one who didn't and one who didn't and 23 who did, we kind of had to pivot to compare the differences between occupational therapy and SLP students. So for our quantitative results, we have the IPASS findings. So we did an independent t-test, assessed differences in interprofessional attitudes based on a 5-point Likert scale. For SLP, the mean was 4.2, and for OT, the mean was 3.96. The differences were not statistically significant between OT and SLP. For the IPEC findings, we also did another independent t-test and assessed differences in interprofessional competencies based on another 5-point Likert scale. The mean for that was SLP was 4.49, and for OT, the mean was 4.02. Again, the differences were not statistically significant, and the results were that both groups had moderately high levels of self-reported interprofessional competence.
So we also, quantitative results, both OT and SLP students showed high confidence in teamwork, positive attitudes towards collaboration. The differences were not statistically significant for IPEC and IPASS. So some qualitative questions that we had, number one, in which aspects of interprofessional teamwork do you feel most confident about? Number two, what challenges, if any, do you face when collaborating with students or clinicians from other professions at clinical fieldwork or externship? Number three, in what way did grand rounds or lack of participation influence your preparedness for interprofessional practice? And number four, if you did not attend, what was the reason for non-attendance? And number five, what, if any, other interprofessional activities did you engage in during your program?
So throughout analyzing our results, we came upon three themes. Theme one was communication and confidence. So students expressed feeling more comfortable speaking with team members, and these are some direct quotes from our participants. One said, "I feel confident in my professionalism and communication skills." Another said, "Communication, respect, and active listening." And another said, "I feel very confident with listening to the perspectives of others and giving them space to share their thoughts." Theme two was role understanding, so better understanding of their roles and others with increased ability to advocate for their own role too. So one participant said, "I feel very confident working alongside the interprofessional team," and another stated, "I really feel most confident with communicating with clinicians and students to understand their unique role and responsibility while also advocating for OT's role."
The third theme that we found were some of the challenges that students encountered, including scheduling difficulties, limited opportunities, and role confusion still existed. So some of those quotes included not really knowing too much about their field and what they do and vice versa. The biggest challenge is schedule planning, ... hard to plan around everyone's schedule, and there were limited opportunities to formally participate in interprofessional activities. So the overall results showed that students reported strong teamwork skills, increased confidence, and better role understanding, while grand rounds also supported communication and collaboration. And while some challenges were still reported, such as limited IPE opportunities, scheduling, and understanding of roles.
So what does this all mean? Findings support the previous research, and students value teamwork, and they feel capable in team settings. Skills are also being applied in real clinical environments. And why does that matter? So better collaboration leads to better patient care overall. It's important within OT and SLP education that students enter clinical environments that require them to collaborate with other disciplines and advocate for the unique contributions of their profession. Findings highlight a distinction between valuing interprofessional collaboration and feeling competent in applying their related skills. Therefore, students need more teamwork training, and they also need continued exposure to interprofessional education. Therefore, we suggest that programs should integrate interprofessional education throughout their entire curriculum.
So some implications we have. So grand rounds may be considered potentially required participation across health profession programs. If participation remains optional, access to these experiences may remain uneven. If the goal of healthcare education is to prepare students for collaborative practice, interprofessional learning should be intentionally and consistently embedded throughout the curriculum. Importance of repeated exposure, which means while a single IPE experience may be beneficial, more consistent participation may better support sustained skill development. The need to expand interprofessional opportunities beyond grand rounds is also important. Results support earlier integration of interprofessional learning, so introducing structured IPE experiences earlier in students' education. It may enhance preparedness, role clarity, and confidence as they enter fieldwork and externships. So our limitations and future research. So it was a small sample size. Most participants attended grand rounds. We were unable to run our original analysis of attended versus not attended, so we had to pivot. It's self-reported data. Future research, maybe a larger sample size, long-term tracking from clinical to professional, following the same students over a period of time, going before grand rounds to after grand rounds, during field work or externship, and then post-grad first semester of practice, and the variety of IPE.
So our final conclusion was 86.7% of students reported feeling confident in teamwork, feeling prepared for clinical collaboration, and understanding their professional role. 62% reported that grand rounds support interprofessional learning and real-world application. There's a need for consistent, repeated exposure to interprofessional collaboration learning. This was our research poster that we had the privilege of presenting at Research Days. It summarizes basically what we just went over, but we also have a QR code for what our survey questions asked, as well as our references, and another one.
Let's hear it again for SALT. Amazing. One more time for SALT. Okay, now we transition to the research group identified, better known as Dragon. Ooh. Dragon members are Ali, Raina, Ellery, and Mr. Corey. Come on.
Hi everyone, my name is Ellery, and this is my research team, Raina, Corey, and Ali, and we're going to be presenting, okay, go ahead, let's clap. We're going to be presenting our research study that we've been working on for the past year now, increasing knowledge of OT's roles and interprofessional educational approach for physician assistant and nursing students. Perfect. All right, so first we would like to acknowledge our principal investigator, Dr. Jennifer Gardner, for her guidance and support throughout this past year, and along with Dr. Gillum and Dr. Enifuro and the students who have participated in our research. So to begin with, the clinical and educational need for our study. So according to the research, chronic disease rates in the United States have continued to rise and remain the leading cause of illness and disability and death. So this highlighted the need for strong and collaborative and preventative approaches within primary care. So occupational therapy plays a key role in health promotion, disease prevention, and chronic disease management. However, despite this alignment, OT services still remain underutilized, and so one of the major reasons for that is because the role of OT is frequently misunderstood by the healthcare professionals and students. So this lack of understanding can negatively impact interprofessional collaboration and the referral patterns within the primary care system. So therefore, our aim of this study was to examine how an interprofessional educational session could improve physician assistant and nursing students' knowledge, perceptions, and confidence regarding occupational therapy's role in primary care. So to guide our study, we have conducted a comprehensive literature review process that included 41 peer-reviewed articles published between 2025, and the literature consistently showed that the healthcare professionals and students have had a limited understanding of OT's full scope of practice, often associating it only with rehabilitation. And the research also demonstrated that interprofessional education can improve knowledge, perceptions of occupational therapy. However, there were several important gaps identified. So some of them were that many studies were conducted outside of the United States, limiting generalizability, and that there was a lack of standardized, brief, replicable educational interventions, and so that's where our idea came from. And so all these gaps in the literature supported the need for our study and helped shape our research question and methodology. So those are the 5 key study objectives that we have come up with. The first objective is to examine changes in the PA and nursing students' knowledge of occupational therapy's scope of practice. The second objective is to assess their changes and perceptions of occupational therapy's role within the interprofessional primary care teams before and after the educational session. And the third is to evaluate their confidence in collaborating with occupational therapy professionals. And fourth, to assess their understanding of OT in primary care and their likelihood of making referrals. And finally, the last objective is to examine their knowledge of OT and treatment methods used within primary care.
So the research methodology that we used to go about our study was a quantitative pre-test, post-test study. We completed the study in the spring 2026 semester, and we did a 1-hour educational session on OT scope of practice and their role in primary care. And we focused on differentiating between OT, nursing, and physician assistant roles and applying them to a case study. Participants created unique identification codes to match their pre- and post-test data to ensure everything remained anonymous. And a total of 41 participants consented, but a total of 32 actually made it through to the end. So we had a total of 17 physician assistant students and 15 nursing students. And they're the ones who completed the study. A researcher developed 15-item Likert scale, was used to assess the data in the pre- and post-intervention survey administered on Qualtrics, and it was adapted from the 68-item questionnaire assessing their knowledge, perceptions, and confidence related to OT and its role in primary care. So this is a little picture from our education session. And topics included OT scope of practice in primary care, occupational therapy's role in chronic disease management, diabetes, hypertension, obesity, and the psychosocial impact of health conditions such as anxiety and grief. The session emphasized interprofessional collaboration through a case study of Mr. J, highlighting the roles of occupational therapy, nursing, and physician assistant students in supporting holistic, client-centered care and improving daily functioning and health outcomes. So our analysis and results. Pre- and post-educational session survey responses were analyzed to assess changes in knowledge, perceptions, and confidence. Descriptive and inferential statistics were used to interpret the data collected. Median and interquartile ranges were calculated, and Wilcox and signed rank tests were used to examine the pre- and post differences. We found significant improvements in knowledge, perceptions, and confidence amongst the PA and nursing students. Strongest significant improvements in understanding OT's role and confidence explaining OT, and statistically significant improvements were observed in both PA and nursing students, with nursing students having greater overall changes.
So just a further breakdown of the results. So this was for the physician assistant students. So we found statistically significant improvements in question 2, which was related to having a better understanding of what OT is after the session. We also saw improvements in other questions like question 3 and 8, which were related to the understanding of OT services, and also as well as 11 and 12, which are OT's role in interprofessional primary care teams. Question 14 showed one of the strongest changes, which reflected increased confidence explaining OT in primary care. And then a further breakdown for the nursing students, there was statistically significant improvements in questions 2 and 3, which was related to understanding OT and OT services, and statistically significant improvements in questions 7, 8, and 10, which was related to collaboration in OT and primary care. And then we also had strong improvements in questions related to understanding and confidence in OT's role. And overall, the nursing students demonstrated more statistically significant changes compared to the physician assistant students. And just an overview of our discussion. So we did a brief interprofessional education session that was 1 hour for the PA and nursing students, and it assessed knowledge, perceptions, and confidence related to OT. We had statistically significant improvements seen in understanding OT's role and confidence in explaining OT, which highlighted gains in role clarity and interprofessional communication. And the nursing students, like I said, demonstrated greater overall improvement by 60% of items compared to PA, which was 40%, which kind of reflects the differences in prior exposure to interprofessional education. Findings align with existing literature showing that even a brief interprofessional education session enhanced role awareness, collaborative readiness, and confidence in interprofessional practice. And overall, the results support that even a single short interprofessional education session can meaningfully improve understanding of OT for other healthcare students.
So just the clinical and educational implications. We integrated a brief interprofessional educational session into nursing and PA curricula and can effectively enhance students' understanding of OT without requiring major curriculum changes or additional resources. Even a single short session improved knowledge, perception, and confidence related to OT, supporting the value of low-burden educational interventions in healthcare education. Improved OT role clarity may lead to more appropriate and timely referrals, stronger use of OT services, and a reduced missed opportunity for earlier intervention. And then strengthening OT awareness among future providers may contribute to more holistic, coordinated care for chronic disease management, prevention, and functional outcomes. So the limitations of our study. The study used a single group pre-post test design without a control group or randomization, limiting the ability to establish causality between the interprofessional education session and outcomes. There was a short-term post-test data only were collected, so long-term retention of knowledge, sustained confidence, and real-world impact on referrals or collaboration cannot be determined. There was a self-reported data may have introduced response bias and external factors like prior OT exposure, exam timing, and morning/Friday fatigue after they had classes and before they had classes may have influenced our participation and responses. And lastly, the small convenience sample of 32 from one university limits the generalizability to other programs, institutions, or student populations. And then future research for this topic should include larger, more diverse samples across multiple institutions to improve generalizability of findings. More rigorous designs, such as randomized or controlled studies, are needed to better isolate the effect of interprofessional education interventions. Longitudinal research is necessary to determine whether improvements in knowledge, perception, and confidence are sustained over time. And use of validated measurement tools and repeated IPE exposure is recommended to strengthen evaluation of long-term educational and clinical impact. And just to wrap things up, in conclusion, a brief interprofessional education session improved nursing and PA students' knowledge, perception, and confidence regarding OT and primary care. Significant gains were seen in understanding OT's role, confidence, in explaining OT, with stronger overall improvements in nursing students. Our findings support IPE as an effective strategy for improving role clarity and interprofessional readiness in healthcare education. The results suggest potential for better communication and more appropriate OT referrals in primary care. And lastly, future research should use larger samples, control groups, longitudinal designs, and validated tools to assess long-term impacts. Thank you so much for your time.
Okay, let's hear it again for Dragon. One more time for Dragon. So for SALT and for Dragon and its members, thank you so much for your contribution to the knowledge of OT and really spreading the word on sort of what the scope of OT is. I look forward for you to continue as you move forward into your fieldwork education, that you continue to be evidence-informed, okay? So now that we have the research part about it, now it's time for celebration. So I'm gonna ask Dr. Gardner to please come back to the stage. And we're about to start the pinning ceremony. So in the brochure that you received earlier as you came in, and I'm gonna read it because I'll mess it up. It says, what does the pin represent? The Kane OT pin represents the successful completion of didactic coursework, and it signifies the transition from academic preparation to full-time clinical fieldwork. So the students are transitioning from the classroom to actually real-life fieldwork experiences. But you have to come back again for the doctoral residency. It serves as a meaningful symbol for achievement, recognizing the dedication, your growth, your clinical readiness, throughout this whole program that you've developed. The pin reflects the student's professional identity and pride in Kane University, symbolizing the value upheld by our occupational therapy profession. So with that said, we're gonna have people come up. So I wanna have our students come over to the steps over there, so start coming up, and I'm going to welcome Ali Costello. And Ali Costello is going to be pinned by Tim Costello, her father. Let's have Lauren Ernst. And Lauren is going to be pinned by her uncle, Tim Schimmel. Anna Fernandez. Anna is going to be pinned by her sister, Maria Fernandez. Mr. Corey Finnegan. Corey is going to be pinned by his mother, Michelle Finnegan. Raina Goldberg. Raina is going to be pinned by her mother, Natalie Goldberg. Ellery Rasmi. Ellery is going to be pinned by her mother, Nermeen Mikhail. Samantha Teo. Samantha will be pinned by her father, Sonny Teo. And our last student, Tanya Teixeira. Tanya will be pinned by her mother, Elizabeth Teixeira. Congratulations again to all 8 of you. And I can't say enough thank you to all the family members, caregivers, and loved ones for supporting them through this journey so far. So, before we start a little bit more fun, we have a little bit of work for this group of 8 here, where they're going to share with you the Kane University Oath. So, whenever you're ready, team, go for it. Yay! They got through it. They got through it. Amazing. Group effort. So the pressure's off of our fabulous 8. So now you can find your seats. And a little bit of a surprise for those attending tonight, or this evening. Our fabulous 8 have put together a small video of their time here at Kane University thus far. So hopefully we'll get a part 2 when they come back. But sit back and enjoy their representation of their journey.
This one goes out to you and yours. Worldwide, I say, hey, I'll be gone today, but I'll be back on around the way. Seems like it. The more I see, the less I know. But I know one thing, that I love you. I love you. I love you. I love you. I've been a lot of places all around the way. I've seen a lot of joy and I've seen a lot of pain, but I don't want to write a love song for the world. I just want to write a song about a boy and a girl. Junkies on the corner always calling my name, and the kids on the corner playing ghetto games. When I saw you getting down, girl, I hope it was you. And when I look into your eyes, I knew it was true. I said, hey, I'll be gone today, but I'll be back from around the way. It seems like everywhere I go, the more I see, the less I know. But I know one thing, that I love you. I love you. I love you. I love you. Now I'm not a highly metaphysical man, but I know when the stars are aligned, you can bump into a person in the middle of the road, look into their eyes, and you suddenly
Woo! Once again, congratulations to Ali, Lauren, Anna, Corey, Raina, Ellery, Sam, and Tanya. Congratulations. So I know you want more, but that's it. So what we're going to do is we have beautiful professional photography with our gentleman there, Ian. Hey, Ian. So Ian's asked for our Fabulous 8 to hang back for some professional photographs for group pictures, and then he's going to hang out for a little bit more, so then family members, you want to take some more pictures together. But for right now, I just welcome the 8 to come back, and then let Ian sort of hang out with you and take pictures. I would love to say and chat with you after, so, but this evening's formal presentation is over, and enjoy your evening with your family members, and congratulations again. Thank you so much.